Hello, my name's Chris Wells. I'm a gastroenterologist at North Tees in Hartlepool NHS Foundation Trust, and I'm going to talk to you about having a nasojejunal feeding tube. So what is a nasojejunal tube? A nasojejunal tube is a tube that's passed through the nose and through the stomach and into your small bowel. To insert a nasojejunal tube, you're required to have a gastroscopy, which is explained in one of our other videos. A nasojejunal tube can be needed for patients in hospital when their stomach doesn't empty properly. This can be due to a neurological problem such as related to diabetes, or sometimes due to an inflammatory problem in cases such as pancreatitis. If your doctor feels a nasojejunal tube will help you while you're in hospital, the procedure will be booked and an appointment will be made for you. On the day of your procedure, you'll be asked not to eat anything or to have anything placed through any feeding tubes that you may be using. The porters will come to the ward and collect you and take you down to the endoscopy unit where you'll be admitted, and the doctor doing the procedure or one of the nurses will go through the consent for the procedure for you. Are there any risks of having a nasojejunal tube? The nasojejunal tube is placed with a gastroscope, and you're therefore required to have a test called a gastroscopy, which is explained on one of our other videos. There are some risks with the procedure which you can look at there or on the patient information leaflet. In terms of the nasojejunal tube itself, this itself is a fairly risk-free procedure and a risk-free device. Sometimes the feeding device can be dislodged and pulled back, and there is a risk that the procedure would need to be repeated so that you get some long-term secure feeding. Are there any alternatives to this procedure? In most cases, a nasojejunal tube is placed endoscopically. The tube can also be placed via an X-ray, and sometimes the doctors and nurse looking after you may choose or recommend this route to you. When a nasojejunal tube is placed endoscopically, it's normally placed on inpatients. On the day of the procedure, the patient will be asked not to eat or take anything through any feeding tubes that may be in place on the ward. You'll be taken by the porter down to endoscopy, and a consent form will be signed when you get to endoscopy. The nurses and doctors in endoscopy will be able to explain any questions that you have at the time. When you come into the procedure room, the doctor or nurse who will be doing your procedure will welcome you into the room, and you'll also be introduced to the staff that will be helping them do the procedure. You'll be given some sedation to make you feel very comfortable for the test, and the gastroscopy will be inserted through your mouth into the stomach and then the small bowel. The feeding tube will be delivered through the gastroscope into the small bowel, and the gastroscope will be removed. The doctor or nurse doing the procedure will then have to do an exchange through your nose and mouth using a bright light and a set of forceps called a McGill's forceps. This can sometimes be a little bit uncomfortable and make you feel a bit choky and gaggy, but the procedure lasts only a few seconds and is normally very well tolerated. After the procedure, you'll be left with a tube coming out of your nose through which we can feed you directly into your small bowel. When the feeding tube is being placed, you'll be taken back to the ward, and the nurses will start the feeding regime outlined by the dietitian to give you the nutrition that you need. Most people who require a nasojejunal tube only have to use the tube while they're in hospital. Sometimes patients are discharged with a nasojejunal tube. Those patients, when they're discharged home, will have training about how to use the device and what to do if any complications arise. They'll be supported by a community feeding nurse who will visit them at their home, and the patient also has the chance to contact the hospital if there are any problems that arise. If any emergencies arise, such as the tube getting pulled back or becoming blocked, then it will be important to contact the endoscopy unit and an appointment made for the tube to be reviewed and, if necessary, replaced.